All right, since it's 6:02, we'll bring the Mashpee Board of Health to order. Present, we have Brian Baumgartel, and on the phone, we have Board Member Veronica Warden as well. And Vice Chair Mallory Langler is not present this evening. So we won't be taking up our sort of normal stretch of business this evening. It's mostly to...
Yep, Kate Gardepy's also on the line.
Yes.
The
Kate
assistant.
Gardepy, who is our Assistant Health Agent, is also on the line with us tonight. This is more just to kind of give an update on where everything's at with this pandemic that's going on, and I believe folks can call in as well tonight if they'd like.
They can, yeah.
Okay, so, yeah, why don't you take it away on the update?
Do you want to do the minutes first?
Oh, sure.
Just because you
Yeah, we can-
typically do
All right.
the expense warrants, we obviously can't do because there's just one member present.
Okay. So, Ronnie, do you have any comments on the meeting minutes from last meeting?
I don't, but Mallory should be present for, to approve the minutes.
I mean, I suppose we can wait. Usually we do them, but Mallory
Yeah,
was
you
present
do,
for that.
but
Yeah, they just went out this
It's always,
afternoon, so I don't know if Mallory had a chance
Okay.
to look at
All
them.
right.
thing to do.
Yeah, then why don't we hold them then? That's a good point. Thank you, Ronnie.
You're welcome.
And as for expense warrants, since we only have one member present this evening,
I don't have any
Yeah,
expense warrants
so-
anyways, so,
okay.
well, we have the one. I'll have you sign, and then we'll have either Ronnie or Mallory come in and sign them at some point this coming week.
Okay, okay, that sounds good. I think that's the only ordinary business we have for tonight, right?
Yep, is
Okay.
the update.
All right.
All right, I just wanted to let the board know what we've been doing as far as within the last, since the last meeting. One of the biggest things we're doing is really trying to keep up with the amount of information that's being sent out through the state, the governor's office and the Department of Public Health. The Department of Public Health is having conference calls on Tuesday afternoons, which we participated in, and those have been great because they other health agents call in and ask questions, and they tend to break down the guidance that's given, and that's helped in a lot of different topics. So each time that there's been an update from the state, we've been updating the town website on the COVID-19 webpage. The situational reports that come from the COVID-19 Response Command Center, which is a group of people that the governor has put together, and they're coordinating the COVID-19 response, and they've been doing even sometimes daily situational reports. We've been informing the VNA and the public of that there is crisis counseling resources available through email, Mashpee TV, and our Mashpee Board of Health COVID-19 webpage. We did create a draft order to close the beauty salons, tanning facilities, the fitness centers, and that was prior to the statewide closure of the non-essential businesses. And so we made up that draft order, but it was kind of rendered moot because the next day is when the state issued and the governor issued that order to close all non-essential businesses. And there were quite a few towns, both Nantucket and I know Melrose was one, because Melrose was the template that I looked at as far as doing that. So there were a lot of towns that were kind of scrambling because we were getting phone calls that the beauty salons and the tanning salons were still open, and obviously they have issues with their service and being in close contact. We did issue a cease and desist to an illegal barber shop that we found operating. Actually, we were contacted by someone who knew it was operating, and so that they've been issued a cease and desist. We've updated key contact people for the town of Mashpee COVID-19 response, so we've been talking to a lot of the key players here in town. We've talked to Stop and Shop management regarding their COVID-19 protocols. We communicated with the COVID-19 information to our public safety answering point, which is the dispatcher who sends out all the calls to police and fire, and they have specific questions that they need to ask the callers who call in to the dispatch center, so to figure out if people who are calling in are infected or not, so that they can protect the first responders. Like I said, we listen to the weekly conference calls for both DPH, Barnstable County, and we started working from home on March 24th, per order of the town manager. So we have been, both Kate and I, as the assistant, and I have been working from home and coming in and going out in the field still. We've given our cell phones on our answering machines, so anyone who calls our direct lines and also the main line can get a hold of us to go out and do inspections. So we still are going out and servicing mainly the septic systems, the septic installers and the inspectors who are looking at systems. They're the ones who really, we have not done housing or food inspections as of yet, but I suppose we will have to do those at some point. And we have access through a VPN connection through our home phone, so that we have access to all of our databases for both Laserfish looking up address information, so we can still service the realtors and the lawyers and the septic installers, septic inspectors, really anybody who's looking for property-specific information for site plans and really any property information. So that part, our customer service has not changed at all, which has been great.
That's good.
We've talked to, especially we've been talking to the VNA. The VNA is acting as our town nurse, and they are doing basically all of the epidemiological investigations into COVID-19. So they are connected to what's called MAVEN, which is the Mass Virtual Epidemiological Network. Anyone who has been tested and is tested positive, so either the laboratory or the doctor, if the state does the test, they will all put that into MAVEN, into that protected database online, and the VNA can see all that information. And then they will call up the patient and determine who the close contacts are, and work on assigning quarantine and isolation based upon the information that comes down through MAVEN. And they've been letting us know who the positives are and their addresses, but we have not released any of that information as far as, and won't release any of the personal information, obviously. So we have been working closely with the VNA on that, because they are handling the bulk of this, and it's worked out well, where we are still getting calls from people who are obviously have questions about being tested, and have questions about to see if they are close contacts. And so when we receive that information, we are sending that off to the VNA, so the VNA can do their confidential investigation on that end of it. And we donated leftover personal protective equipment to Mashpee EMS. We had 1,500 pairs of nitrile gloves. We had 1 box of masks, syringes, tablecloths, Band-Aids, and alcohol swabs that were left over from the 2009 H1N1 when we were sent that information, or sent that equipment to do both the influenza clinics. And we had that because we had to do, we had multiple public clinics, and we also took care of the schools. and that was leftover equipment that we had not used. So that was given to the Mashpee Fire Department, and they actually did end up getting some equipment through the national stockpile. They actually had one of the military vehicles come down and deliver that. So they should be all set for now. We've disseminated information to Mashpee long-term care facilities, where we have been contacted by a couple of them to find out how to order resources through the Region 5 emergency planning area. So we have sent those. We sent the proper guidance on how they can order the supplies, and we also had a request to see if there was a program for anyone, if anyone had made a program to do on-site testing at the long-term care facilities. And when we got the request, there really hadn't been, but I think that there is right now. So they have a process on where they can request that to have somebody come and test. And I think there are more tests available now, which is obviously the key thing. And I think that is one of the reasons why they have the ability to have someone go to the long-term care facilities and can test many of the people rather than just the one sick or whoever the sick individuals are.
Right.
So I think that is just getting ramped up. I think yesterday was the first day that they offered that. And that process for requesting supplies has also changed several times. So we've sent them information on how to request the supplies through the Strategic National Stockpile.
Okay.
We've talked to many of the food establishments on best practices while they were operating for takeout and delivery. And I just want to talk about as far as how and why we're not disseminating the numbers. We maintained our ability to conduct inspections, investigate complaints, issue permits, and continue other essential services to the town while working remotely on the COVID-19 emergency. We remain a confidential office and have deferred all case reporting to the Department of Public Health or at the discretion of the town manager. We've been updating the administration. And our message that we've been telling both the public and people who called that because we are a confidential department, that knowledge of the number of the COVID-19 cases in Mashpee does not change our guidance to the public. That no matter how many people are reported to be sick, people should assume that the COVID-19 is widespread in the Mashpee community and act accordingly. Stay home whenever possible, maintain a 6-foot distance from other people in public spaces, wash your hands frequently, and sanitize common high-touch surfaces often. So that's how we've been operating, and that's worked out well. Some people don't like the fact that we're not releasing the cases, but that information is always sent up to the state, and the state will release that information. Statistically, right now, they've been releasing it by county. Other towns have been releasing it. But they've been using the basis that it is part of their risk and public for public protection. But I don't feel that way. But I think that it is up to the town to disseminate that information. We did hear from the Mass Department of Labor Standards. They contacted us regarding non-essential businesses that were still operating, and they have made up a list that the Board of Health will have to follow up on. So we may be going around and letting know that the non-essential businesses that are operating will have to close, and see what follow-up we have for that. I have not received the list yet. We did get a call regarding Johns Pond Village, which is a seasonal campground, and we sent them the guidance that the governor had on the restriction on the vacation properties and lodging, to let them know that they were going to have to, or not open, or that the proper restrictions that they could only house people who were in support of the COVID-19 response. So we sent them that guidance along. And we were contacted by a woman at Southport who offered to make masks. And so I did let her know that there is still definitely a need for masks, because that's one of the items that we've been requested through the long-term care facilities. So if that's possible to be made up, then I think that would help.
Right.
Just, I did want to talk about the beaches. I guess the state closed the state beaches today, as far as the governor closed the state beaches. We have not closed the beaches. I think the beaches are still an area where people can go and exercise. We do want people to go out and be able to get out of the house and to walk. Walking is one of the best things, and the doctors that have been talking about how to relieve stress and to relieve anxiety is that walking is one of the best things that you can do.
Yep.
And really, we want to leave the parks. Parks should be open, and just for people to use common sense and to social distance and not congregate. It's 45 degrees out, so I don't think people are spending a lot of time picnicking on the beach
Yeah.
like they are down south. And, should this continue into the warmer weather, then we may have to look at that if people are starting to congregate and spend more time in some of these other larger public areas.
Right.
But at this point, I think that they still need to give them some options to go out and get out of the house where they can do it safely.
Yeah, I agree with that. Does our police drive by there occasionally to kind of monitor the
Yeah, we've been
situation?
down, there have not been a whole lot of people at the beach. There are still people going there, but I have not seen them to where they're congregating, so.
Okay.
Please
right.
keep a closer eye on that, Glenn, okay?
Yeah, I think with the state beach shut down, certainly more people will want to go to the Mashpee beach. I mean, we don't have many, but,
That's right. yeah.
They're abutting each other. There isn't
Yeah.
really that much difference between the
Right,
beaches.
Right.
We only have the one coastal saltwater beach.
Yeah.
But it's also associated with the state beach, so I think it doesn't need to be monitored.
Yep, absolutely. Brian, you had contacted me about the short-term rentals.
Yep.
There has been guidance also that covers all types of lodging, and short-term rentals was included in that. Again, there are specific uses for the short-term rentals. It still has to be for only personnel that are either in quarantine or in isolation or are in support of the COVID-19 response. And those are the only people who are allowed. So there is no vacation scheduling that could go on, or vacation type of use for that right now.
Right.
And what just actually happened today is we just got the contract with Lodging Revs, which is the third-party company that is going to identify the short-term rentals in town. But one thing that we're going to work with them on is sending out, and I did speak with one of their reps, is they have sent out for other towns regarding the bans on the rentals and the lodging and the specific restrictions for use of the short-term rentals.
Okay.
So I think that's going to be a good thing where we can send out a blast email or blast communications to handle quite a few of the rental properties in town.
Right. Oh, that's good. I had a question and it just escaped me. I'm sure it'll come back to me in a moment. Oh, yeah, so immediately prior to that closure by the governor of the short-term rentals, I did a little poking around on Airbnb just to see kind of in town if there were any that looked like they were booked up in April. There were a couple. It wasn't, most of them, for the most part, they seemed like it was empty, most availability
Yeah.
around town. But there were a few that were definitely booked during the month of April and into the beginning of May. So I don't know if those were directly tied to this or they were previous bookings, but I was glad to hear that news come down from the state about
Yeah,
about those restrictions, because it is a concern for a lot of folks on the Cape with, a lot of travelers coming from other areas who might be coming from
yeah,
sort of the hot spots in New York City and Connecticut and New Jersey trying to escape. So,
Right.
Yeah, hopefully
Well,
that.
again, I
helps with
think
that.
that's difficult to enforce if the people own property here. It's tough to tell them they can't go to their
Yeah,
the
yeah.
property that they own in town.
Certainly our second homeowners can come
Right.
at will, but trying to at least keep the vacationers, or not vacationers, but people trying to rent a property to escape where they are.
Right,
I think that's a good thing.
right, yeah.
So,
Yeah, the CEO of Cape Cod Hospital sent out a notice regarding that too, really asking the people who come to make sure that if they do come, to self-quarantine, and that they would be helped if they get sick, but kind of asking them to not come if they're sick, because our hospitals are going to be stressed,
yeah.
just like every other hospital will be, especially as we expect this surge.
Right, right. And Falmouth Hospital has a minimum of emergency room beds. It's 8 to 10 beds, I think, in Falmouth, and, Cape
Yeah,
Cod Hospital's
and-
not much bigger, so we can't, if anybody's seen the pictures coming out of New York City
Right,
with people parked in the hallways, and, so,
Yeah.
I mean, let's keep it, hopefully we can kind of keep it just to our residents as much as we can.
yeah.
Good. Ronnie, did you have any questions on any of those or any other things you wanted to bring up for the COVID piece?
No, but realistically, when people are driving down to their summer homes, they have to stock up for food, and they're not going to quarantine themselves for 14 days where they don't have any food in the house. So I think that is kind of unrealistic in that asking people to quarantine themselves, which they should be doing. But I don't think it's going to happen.
Right. I mean, would it be helpful to get signage at the stores or something like that, the grocery stores, to, notify, second homeowners coming down? Because I think it's only going to increase as the numbers kind of creep up, as,
Right.
all the Boston second homeowners are going to say, hey, I'm getting out of Dodge.
Yeah,
So
Well, I think
maybe,
the biggest thing is to send out reminders that there is the Peapod from the Stop and Shop that will deliver your groceries.
yeah,
Please stay quarantined and order your groceries from online services such as, so that these folks will have, and a phone number so that they'll have something to directly contact with, you know what I mean,
Right.
to order their essentials,
right, yeah, exactly. Try to keep them out of the grocery stores as much as we can, at least initially. Certainly, once they pass their quarantine period, they could go more freely. But the grocery stores, I can kind of see, is becoming a little bit of a hot spot where everybody's, we gotta get our groceries. I went there yesterday.
Right.
I
I did notice that traveling on MacArthur Boulevard, that I don't know, I think it was the town of Falmouth that actually had the big lighted signboards out for those visitors to self-quarantine for 14 days,
That's good.
which I thought was a great idea.
Yeah, no, that's a good thing to do, I think. I don't know if the town has any that are available, but if we could put one at the Rotary or something like that just kind of faces down 28 or 151, that
Yeah,
would just give that notification, because the Rotary is such a,
there was one on 151 too.
oh, okay.
That's why I think it was Falmouth and not Bourne,
Oh, okay.
because it was that part of Falmouth where I saw it.
Right.
So
Right.
they're doing a good job notifying people too, as far as that, but they're definitely one of the gateway communities coming over the Bourne Bridge.
Yeah, they are.
Yeah,
They are. And hopefully people are paying attention to those requests. When I was at the grocery store yesterday, I did see a lot of people wearing gloves. A lot of
Yep.
people wearing whatever mask they could find. Some people with just scarves over their faces.
Yep.
It was kind of an interesting experience. I was glad to see that the grocery store had been pretty significantly restocked with some of the items that have been, really depleted. Of course, the toilet paper apparently is still missing, and pasta is apparently still very popular. But it does seem like, they're trying their best to keep stuff in stock as much as they can. So
Right.
and they have, of course, the new sneeze shields at the checkouts, which was good
Yeah.
to see. And they,
Yep,
making sure people stay behind them, not letting people use their own bags, so don't bring your own bags unless you're doing the scan it
right.
thing yourself.
Yep. That guidance document was sent out to the stores for people not to bring their reusable bags in.
Okay. Has Roach Brothers been following that same guidance? I haven't been over there. I've only been to Stop
Roach
and
Brothers
Shop.
has always offered paper, so I don't think that they even deal with the reusable bags.
Oh, okay, okay. Yeah, yeah. Yeah, it's just, anybody who watched the governor's message this afternoon, it looks like the peak is gonna happen in the next couple of weeks, so
Yeah,
it's only gonna get worse from here. Like Glenn said, you really have to assume that there are people in town who are infected. You
Yeah.
can't,
yeah,
at this point, do not operate on the idea that it's not in Mashpee yet, because it most definitely
Yep.
is.
Yep.
It's everywhere. There's 200-something cases on the Cape now, so
really?
it's, pretty much just assume wherever you go on the Cape, you could run across somebody who is, infected with it. So
Right.
take every precaution that you can and avoid going out as much as you can. Do one big grocery shop instead of going out
Right,
every other day. I was
Yeah.
standing in line, and the cashier was talking about some of their sort of regulars who come in every day, who are still coming in every day.
right, yeah.
It's Trying to discourage that type of behavior is, it's tough. But,
Absolutely,
but try to get it into one. Use the P-pod service, which is great.
yeah,
I think you can use. Are they still doing the outdoor pods where you can just pick up and go?
I believe so, yeah.
So yeah, I guess try to use that as much as you can and plan ahead. Order extra. Don't hoard, but order a little extra so you
Right.
don't have to go.
Right,
Yeah, because I think next couple of weeks, what we've seen so far, it's been bad, but it
Yeah.
certainly seems like it's going to get worse from here.
right,
Until it'll get worse before it gets better, and it will get better. But
yeah, it will.
we've all just got to redouble our efforts to, respect the 6-foot separation, stay at home as much as possible. It's really, what happens in Mashpee is going to be determined by our citizens and what they do, really.
Absolutely.
Yeah. So. Okay.
Kate, do you have anything else that I missed?
No, I think you covered it, Glenn. Thank you.
I think you had a couple of other sort of non-COVID updates. You want to do those, and then we can.
Yeah, I just wanted to let the board know that things that we've been doing, part of our routine, we did get contacted by Ty and Bond, and they're looking to do the landfill monitoring, and they wanted access after hours, so we had them contact DPW to get access to the landfill so they could do their landfill monitoring. We did get we got notified by the fire department that there was a drum of hazardous materials stored outside at a construction site with some hydraulic oil. And so we contacted the owner of the property. This was just yesterday. I have not gone back out, but the owner said that they would take care of it. We're still responding to complaints. One of the complaints was that the porta potties down at New Seabury were not being serviced. We went down and everything looked okay as far as that. We talked to IT and to try to figure out the Zoom meeting, which we did not have to use tonight. The septic systems are still being installed and inspected on a regular, pretty much steady basis. So that tends to be our biggest volume that we're dealing with in the office. We're going out and doing the installation inspections. We had a full day of perks today. It was a full day of perks for the previous 2 Thursdays. And next week, there's one scheduled, but I would expect that to fill up too. So on the construction side of it, the construction folks are busy. The realtors are still busy. We're still getting calls for information on properties and septic systems. So that's one part that has not slowed down, is the construction side for both building permits and septic. So that part has been good and has been definitely keeping us busy along with all this other COVID-19 related stuff.
Right.
So we're hanging in there so far.
Yeah. Well, thank you for that. Thank you for keeping the ship running. And,
Yeah.
And,
Well, the VNA is doing the heavy lifting right now with this.
Yeah.
But we've been assisting where we can.
Right, right. Well, I mean, if a vaccine is developed, that'll be your prime time for sure. I mean,
Yeah.
So, all right. Yeah, so I just kind of wanted, I mean, I felt it was important for us to still hold a Board of Health meeting just so that we could pass along some of this information. I don't know how many folks are watching tonight. Hopefully some people tuned in to watch and have taken the messages to heart, you know, go out there, but, you know, to get some fresh air when you can, but also do it safely and avoid too much contact with folks and, you know, wash your hands, wash your hands, wash your hands.
Right.
Because it's one of the best defenses that we have. And it's all we have right now. Without a vaccine, this is what we've got to do, so we've got to do it. So, yeah, I thought it was important for folks to see us out here still fighting the good fight, and, you know, that's about it for me. Did you have anything else, Ronnie?
No, I didn't.
Okay. So, yeah, if nobody has anything else, I guess I'll make a motion to adjourn the meeting.
And I'll second that.
All those in favor?
Aye.
Aye. Thanks a lot.
Take care.
Thank you.